Welcome, everyone, to the webcast series, The Public Health Insider. My name is Casey Farm, and I'm the Director of Alumni Relations for the College of Public Health and Human Sciences. I am delighted to introduce today's moderator for the episode, Living on the Edge, Rapid Social Change, and Uncertainty. This is the last webcast of our third season of the Public Health Insider series. You can watch any episode from this third season or any of the previous seasons at osualum.com/public health webcasts. A couple of logistical items for today. If you look at the bottom of your screen, you will find a Q&A chat button. You are welcome to type your questions throughout any point during the talk, and at the end of the presentation, our panelists and our moderator will try to get to as many of them as they possibly can. Our webcast series is hosted by the OSU Alumni Association in collaboration with the OSU Foundation, the College of Public Health and Human Sciences, and the OSU Center for Health Innovation. We are really excited to continue this series now in its third season. We will be bringing season 4, so stay tuned for that, surrounding public health, what it is, why it's important, and how it applies to our lives and our communities. For more information on public health and all the other incredible work throughout the human sciences and the work that's being done within the college, visit health.oregonstate.edu. Now on to today's moderator, who introduced today's topic, and our panelist. Really excited for this one today, guys. I know it's going to be a good one. Our series moderator is Dr. Allison Myers, and she's the director of the OSU Center for Health Innovation within the college. The center serves as a connector between external organizations and Oregon State University faculty in the discovery of innovative solutions to pressing health and wellness issues, and builds workforce capacity in public health and human sciences. In service to meeting the most pressing public health needs in the state of Oregon, the center is home to projects related to the COVID-19 response, which includes Trace OSU and the Trace Community Projects, mental health promotion and substance abuse prevention in rural Oregon, and improving food security for Oregon Health Plan members through store-based changes. It is now my pleasure to introduce and turn the webcast over to our series moderator. Welcome back, Dr. Allison Myers. Glad to have you.
Hi, Casey. I think I turned my camera on a little early. It just shows how eager I think we all are to be able to bring Rick's book. So this is season 3 of Public Health Insider. The first episode, we talked with Kate McTavish about housing, and we learned about doubling up. And so I'll plant a seed there. We're gonna hear about doubling up again today. A couple of weeks ago, we heard from the Outdoor Recreation Economy Initiative. We talked about making the outdoors accessible to all. And today, it's thrilling. When you get to know people at a new workplace, like for example, I didn't know that my supervisor wrote the textbook on advanced epidemiological methods. And here I learn, as I get to know you, Rick, here we are on the day-to-day making things work in the college, and look at your expertise, your experience. And we get to learn all about it today as part of the launch of your new book, Living on the Edge, which covers families, where you're going to tell us about it, families that were born in the 1900s. But it's remarkable as you walk through the book. I got a lot of tips on marriage in this too. And so we're going to make sure we talk about that. Let me introduce you, Rick, and then we'll jump right in. I know you have a short set of slides, and we're going to have a conversation. The audience, folks who are in attendance, start sending your questions now, please. We want to hear from you. We want to know what you're thinking. We look forward to a very active Q&A throughout the whole hour. Okay. Dr. Rick Settersten, you're the Barbara Knudsen Endowed Chair and Professor of Human Development and Family Sciences at Oregon State University. You also play a role as the head of the School of Social and Behavioral Health Sciences, which is sort of one half of the College of Public Health and Human Sciences. And you're the founding endowed director of the Hallie Ford Center for Healthy Children and Families, who we've heard from too as part of the Public Health Insider. Welcome. Thank you for taking the time today.
Thank you.
Let's jump right in. The book
Okay.
Living on the Edge is drawn from data that were collected from something called the Berkeley Guidance Study, and you're going to walk us through some of the basics so that we can ask you better questions.
Happy to lay a little foundation, Allison. Allison sent me an email message about 2 hours ago saying, maybe you could open up with, when did it start? What took part? What was the point then?
Yeah.
And a number of other questions. So I thought I would just quickly open with a couple of slides to help lay a bit of a foundation so that we have a place to start with some conversation.
Perfect.
Maybe I'll just say that I've been here at OSU for 15 years now. It's passed in the blink of an eye. And I was hired, especially when the college had its vision aimed at becoming a CEIF accredited College of Public Health and Human Sciences. And so I was here kind of on the ground when we were making that leap. And it's been my pleasure to serve in a number of leadership roles here in our College of Public Health and Human Sciences. You can often find me working and thinking kind of at the intersections between disciplines, and especially some more macro. As I think about the life course, I especially think about how the life course is shaped and even determined by sort of more distal spaces. Spaces of the kind we're going to talk about today when we talk about historical events and periods of social change. I think about sociology, I think about demography, I think about social policy. These are in some ways a kind of framework for understanding the life course, and these large scale social forces, as we're going to see today, and as are so powerfully shown in the book, really get expressed in individual and family lives in important and profound ways. And I can also often be found asking questions not about particular age groups or life phases, but about the sort of whole arc of human life. And you'll see that reflected in our discussion today as well. So give me a chance here to quickly open up and share.
You click around while I say too to our audience that we're going to bear with you on the screen sharing. And you're going to also teach us about some life course principles. That's a term that you've used a couple of times. And I want to make sure we teach as we go along. They're all really helpful contextual things for us to think about because so much of this relates to our own lives.
Sure, absolutely. Okay, let's get started. There's the cover of the book. The book just came out in the beginning of February. So it's only been out a few weeks, about a month now. And it's just been great to finally hold it in my hands after all these years of work with my collaborators. So let me figure out how to do this. Let me start by just maybe making a couple of comments about the story of the book, how it came about. And I need to somehow move this. There we go. So the book essentially contains data that span a century. And the idea for this book came about nearly half a century ago when Glenn Elder, one of my senior colleagues here, wrote the now classic book, Children of the Great Depression in the early 70s. Children of the Great Depression was actually a book about children who were born in Oakland in 1920 and 21. But in the process, Glenn discovered the Berkeley data and also this rich archive that was not just about a study of children who were born in 1928 and 29, but about their parents as well. And their parents were born between 1885 and 1905, which is why we call them the 1900 generation in this book. And anyway, the children were followed across their whole lives. But as part of studying the children, they were also, as a family study, studying the parents. And so it's the parents that we're really going to be looking at today. But 40 years had really passed since Glenn first envisioned the possibilities of a book like this. And he brought us together almost a decade ago to begin working, making good on the promise of that idea and the possibilities of that archive. Lisa, so this is a series of photos actually from a pivotal meeting in 2012 at the American Sociological Association meetings. You can see on the whiteboards behind us the writings of a madman, that AKA me, trying to kind of map out our vision for the book. And we took a moment to just quickly snap some photos, and I'm glad I did, because these are really precious moments in a process. And we all look back on this as just a really invigorating and a transformative meeting for our team, which was perfectly intergenerational and also perfectly complementary in its own way in terms of our skills and interests and expertise. Okay, so let me say a couple of things about why the book is going to become important. First, it's a book about how a rapidly changing world affects human lives. That's about how social change leaves people unsettled and disoriented, how it demands that they adapt to and cope with change, how it alters their lives in profound and often unforeseen ways. It also captures a generation, this 1900 generation that I mentioned, that's been rarely studied. And what's going to become so fascinating about this 1900 generation is that we're going to be following them over the course of the century, over what Robert Gordon called a century of revolutionary change. And if you think about it, in some ways, the changes this particular generation encountered were unimaginable. Changes in migration, in wartime, in great swings in the economy, upward and downward, in unimaginable inventions and advances in science and technology. As one person associated with this study said in the 1980s, never again will history equal the rate of change of this period, from covered wagons to the moon. And I love that quote because it so nicely illustrates just just again, the scope, the magnitude of change that this generation was experiencing. What I also love about what we found is that this generation becomes what we're going to call a hinged generation. And this is a term from Leonard Kane years ago. But what Kane meant when he talked about hinged generations is that they become a hinge between the past and the present. The lives of the 1900 generation are going to be dramatically different from the generations before them. And the changes that they're going to instigate and navigate in the course of their lives are going to echo through and be further developed by successive generations of the last century. We're going to see this in the profound changes that they experience with respect to the nature of work. We're going to see it in the growing separation of workplaces from homes. We're going to see it in the expansion of higher education. We're going to see it in married women's increasing labor force participation. We're going to see it in greater egalitarianism or equality in the marital relationship. We're especially going to see it in how they go about the business of parenting. Again, dramatically different from generations before them, and set in place a set of changes that are going to echo later. This is going to be a path-breaking, lifelong study. We're able to follow these parents from their earliest years all the way into their old age. Again, we're following them for almost a whole century, and we're getting a view of families across multiple generations. So what's so special about that is because we have these long-standing data, we're able to really trace how these events that occur in their lives get expressed, how they affect them as individuals, how they reshape family dynamics and family resources. And in seeing the whole of life, we're going to realize that no one's life comes down to a single event, right? That we're looking at a sequence of changes across society over the arc of their lives. And we're investigating what those changes mean as they move through the years. What I love about this too is that families, as one of my mentors, Gunhild Hagestad, said, families are the gathering places of history. They're the places where we make sense of history, where we explore and understand how we're similar and different, and how history leaves a differential mark on us as members of those distinct generations. Anyway, all this is to say that, that this topic about navigating social change seemed so especially relevant in our own era of accelerating change and discord. We're also going to find that as a result, some of the things, some of our results are going to challenge conventional wisdom, and this is often because we're really, as we understand the human life force, we're especially focused on how many of the things that we take for granted in life today emerged out of the post-World War II era. But in being able to actually look back to decades before that, we're going to see some instances where the fact that science relies so heavily on data after the 1950s, it ends up erroneously reinforcing a narrative and makes inaccurate assumptions about what was going on in the early part of the century. So the study is going to allow us to see firsthand really what's happening in individuals and family lives over time. Okay, just a couple more comments. I want to give you some basic foundational information about the Berkeley study itself. The Berkeley study was begun in the late 1920s at what was called the Berkeley Institute of Child Welfare. And Jean Walker McFarland, you see her up there in the upper right-hand corner, Jean McFarland was its founder. Jean McFarland was really a revolutionary researcher and thinker, who was also the first female faculty member in UC Berkeley's Department of Psychology. So she was revolutionary in lots of ways. She will particularly be a driver of the Institute's emerging reputation for these landmark longitudinal studies of children as they were followed into adolescence and their later years. Of course, what Jean McFarland would not have known would be that those studies continued, that those parents and children were followed for the bulk of their lives. So as I said, the parents are born between 1885 and 1908. And there are 420 parents, 210 couples. And the thing that they all had in common was that they had a child in Berkeley in 1928 and 29. So in telling the story of the parents' lives, we're sort of pulling the view back and in the beginning of the book, even trying to understand how they came to California, what their own migration stories were, if they were from outside California or from inside. How did they get to Berkeley? To then have this common experience of a child in the late 1920s. So there was periodic data collection pretty regularly from 1928 to 1947, again in 1969, and again in the early 80s. There are going to be a couple of analytic distinctions that are really going to be critical to understanding how their lives unfold. Of course, gender is going to be a key one. The life scripts of men and women are, unsurprisingly, pretty distinct. But as we're going to see, they're also being really reworked. And the women and the men, but especially the women in this study, are kind of at the forefront of trying to rewrite women's life scripts in particular. Social class is going to be really important as well. 3 out of 5 of these families were in the middle class in 1929. But we're going to see that contrasts in social class, so whether you were in the working class or in the middle class or even higher, will make a difference in terms of how you experience many of these events. And something like the Depression, what's also going to matter is deprivation, how much you lost, even if you were in the middle class. So quite apart from your class status, how much you lost, the degree of deprivation is going to be an important part of the story. Because how much you lost is going to inform the kind of new vulnerability you have and how much resilience you have in being able to bounce back from it. Also, the generational status of the individual in the extended family and cohort membership, which is just really trying to indicate when people were born And we're especially going to contrast, in some cases anyway, contrast those who were born in the 19th century versus the 20th century. So even though we call them the 1900 generation, those who were born before that watershed and after that watershed show some different life patterns. Okay, so Allison loves this quote, and I love it too. We open the book with it. So let me share it with you. This quote is one that offered us regular inspiration as we were writing this book. And the quote is that we are unsettled to the very roots of our being. We have no precedents to guide us, no wisdom that wasn't made for a simpler age. We have changed our environment more quickly than we know how to change ourselves. So, an amazing quote. It could have been written by any of us in the Zoom call today. The sense that the world around us is changing faster than we are. Well,
Yeah.
Who wrote it? A guy named Walter Lippmann wrote it in 1914, and it comes from a book called Drift and Mastery. And Lippmann was an American writer and journalist and social commentator, and he was himself a member of the 1900 generation. This quote and that book essentially arrive on the eve of World War I. But for us, it was such a it was a constant touchstone in our own inquiry into how the revolutionary changes of the last century were leaving a mark on the people. And for us, it was also a glimpse into this timeless human theme, at least since the 1900 generation, the sense of accelerated change. Yeah, so I guess I could stop there. Allison, you wanted me to say a little something about the life course, should I?
I do, but I also just want to interject at this point that, I mean, just hearing the introduction, I have these notes to myself, like, isn't every generation a hinged generation? You don't have to answer that yet. But, and then, when I was reading through the book, I don't think we can stress this enough, this sense of like, there was no wisdom that wasn't made for a simpler age. When Casey and I and others, when we think about why we do this webcast and why we gather, right? It's not your average Zoom call. We ask people to pull up with their tea or coffee in the afternoon, right? Take a deep breath. Exactly. Like, join us as we sort of unpack what's going on. We started this in COVID times. This feels highly relevant. And like, it could have easily been written right now. And so I love that it was a touchstone for you as you wrote the book. And I will say too that as we walk through, I want you to teach us a little bit about life course, because that's the perspective that we're going to take. And then I think we're going to jump into marriage after that.
Sure.
If that's okay.
Yeah, I was just say it would be fine to step into marriage.
Good. I'm not proposing, but yeah. So let's learn about life course, and for members of the audience, folks who are listening in, like, what are your thoughts or comments so far too, as Rick goes back into making sure we understand this perspective, life course perspective.
Yeah, I'll only say a couple things about it. So as I mentioned, Children of the Great Depression, the book written by Glenn Elder, my collaborator in the early 70s, is a classic book because it kind of crystallizes a set of ideas, or it starts to anyway. And then in his subsequent work, of course, there's other work and there are other propositions related to the life course. But I think there are 5 basic principles that we especially talk about that's kind of our big, broad issues that I hope that members of the audience will even begin to apply in their own lives in some way. Let me just quickly advance. So again, we call these paradigmatic principles because they are pitched at this high level, but they're basic points about how we need to understand human life. And the first is really what's called the interdependence of lives, of linked lives. And that's basically that, our lives are not our own. We're embedded in relationships with other people, and the welfare of those other people is dependent on us, and our welfare is dependent on them. So then the understanding of the life course is actually about studying life courses. It's plural, because we move together through time in these interdependent relationships, really, right? For me, this notion that we're independent is a kind of illusion. None of us is independent. And I think so. We are in this study and in much life course research trying to make visible how our lives are really intertwined with others, and our welfare kind of, in a way, mutually it mutually affects each other. The second principle is going to be about timing, and really by this we're trying to imagine that the effects of encountering large-scale social changes or even personal transitions really rest on how old you are when they happen, right? Whether they sort of happen on time or off time. Off time could be they happen early in life or that they happen late. But the sense that timing, when things happen to you, makes a real difference. It has real consequences for your life and your relationships. So that's going to become a central dimension for us. Third, this sort of principle of historical time and place. This is what this book is all about. It's about situating the lives of these people in their economic, cultural, and social environments so that you can really see how life as it unfolds is affected by those environments. A fourth principle is really a principle of human agency, and that's that people aren't passive recipients of forces outside them. I mean, they make choices and they take actions that also affect the direction and the outcomes of their lives, right? So that there's some dynamic interplay between structural forces that push down on you, and then also how you respond. The actions you make and the decisions you make are an important part of that process. And finally, just this very basic principle of lifespan development, which is that human development and aging are lifelong processes that have to be understood from birth to death. And so often we can't study that long arc of human development, but in this study, we have a precious opportunity to do that. Anyway, Allison, what are you thinking?
Super helpful. No, I mean, I think for folks listening, for me, this like lets me breathe a little sigh of relief. I think about all the different learning I've done as I've aged, and it's helpful to know, right, that yes, you always are a work in progress, and you cannot control all of your relationships. There are going to be events that shape sort of how you feel, how you show up in the world, and we've got a question that's about Berkeley, and I am going to pose that to you. And I really like the question because Timothy says, I lived in Berkeley for 4 years in the second half of the 1970s, and I love it that we've got audience members sort of layering themselves into the book. I did the same thing, right? We determined that it was my great grandmother, Minnie Pearl Castine, who was the generation that you would have studied had she had a baby in Berkeley in 1928. But Timothy says, I lived in Berkeley for 4 years in the second half of the 70s. It seemed to be ahead of its time and a trendsetter. I don't know what it was like in the 20s. Berkeley seemed atypical in my time there. Was it markedly so in the earlier years? Question one. And can you extrapolate from Berkeley to other communities?
Yeah, it's a great question, and something constantly on our mind. So we have this precious archive that in some ways is also highly selective because it was a space-based sample to start, right? It was every third birth in the city of Berkeley in 1928-29. Like so there's something about it, even its very origins, that leaves it select. And of course, the other thing we have to keep in mind with long, long longitudinal studies like this, there are also selective dynamics when it comes to how long people survive and who survives, and the kinds of people and the kinds of characteristics that long-term survivors have, and people who stick in a study for that long too, right? Basic attrition issues. Timothy's question about Berkeley is great because it's also true, like the migration stories of these. We know that westward migration and the migration stories of these families are amazing. Some come from Europe, some come from make the trip across the nation. Some come from within California, but Berkeley is a draw. For these families, this is a place where the university is there in the backyard. It's a place where university education is free, actually. So it's a destination for that reason. It's a destination because there's good healthcare and quality of life. So the kinds of people who make it there, however, whatever their path, become selective in their own way, but also they're being pulled to that particular location because of what it provides. So you have kind of push and pull factors that are going on in those stories. So yeah, it's my perspective that's and ours, I guess, shared as an author team, research team, that some of the things that we're seeing in these folks may actually be a little ahead of their time. But they do become big currents in the rest of the century. But it's quite possible that they're a little early when it comes to some of the things they're navigating. We can maybe talk a little bit later about parenting, but that's a good example. We read the stories of these parents and how they talk about parenting and how they talk about parenting their children in ways that were different from how they themselves were parented. They almost sound like modern parents. We just wrote a blog on this topic that these parents of the 1920s actually become kind of early carriers of some of the intensive parenting that we know today. I mean, a much different form and much more extreme, but nonetheless, that the way in which they're approaching their roles as parents, approaching their roles as men and women and mothers and fathers and husbands and wives, they are refashioning those roles in important ways. And we don't have the answer to that question. We don't know whether they were just a little ahead of their time or whether these waves were going on in other places.
Well, let's go there. Let's go there. Let's go to parenting. I do not have children. Dr. Spock, though, I've heard of Dr. Spock. Dr. Spock's book came out in the 40s. This is one of the chapters in the book where we've officially gone to skipping around. If you need to go back, we can do it, but let's talk about it. As a non-parent, I hear around, like, when I was a kid, my parents just told me to, like, be home before the streetlights came on, or, I was a latchkey kid. And the quote that starts chapter 12 in the book is, this is from one of the participants in the study. It says, previously, parents just let children grow up and hoped they turned out for the best. Parents of our generation worry over what we have done wrong. And I fast forward to how my dearest friends think about how they parent their children and the extent to which, they're setting their kids up for therapy in however many years. But anyway, tell us what was happening with the seed of intensive parenting.
Yeah, so this is also partly a product of the study that they're part of. So that also makes it difficult to disentangle how much is the effect of the study as a sort of intervention into parenting, and how much are they indicative of a broader again, sea change in parenting. So we're the middle class parents in this sample. We suggest are really at the forefront of this deep cultural turn and becoming carriers of some new ideas and practices. What's important to recognize, again, thinking about where they're anchored in history and being born around the turn of the century, we know that they're all parenting young children in the 1920s, in the late 1920s, because that's how they got into the study. The 1920s, this is really the time when the science of child development begins to emerge. The Society for Research in Child Development, for example, marks its origin date as 1922. Parents Magazine emerges. There's an NBC radio series called Your Child. There's a swirling of lots of new thinking about child development and about developing institutes like the one at Berkeley. There are about a dozen around the country that are formed in the 1920s, who are explicitly given the task, they're funded in order to conduct high quality research in the service of child and family development. And so, again, they're part of a study, but they absorb a sense that parenting is a skill to be learned and mastered. They talk about all the opportunities that they're trying to provide their children that they didn't themselves have. Whether that's about music and art and dancing lessons and clothes and toys and good nutrition and better education, the list goes on. These parents are also saying they're actively deciding not to have as many children as their own parents, precisely so that they can make more investments in them. One middle-class father says, parents used to have an easier time raising children because they didn't pay so much attention to them and they just let them grow up. This may be similar to the quote you read. They didn't have all these inhibitions. Our children have been tied up in one thing or another ever since they were born. All that takes up the parents' time. So there's new awareness about the role that fathers play in the development of their children. And there's this sort of dark side to becoming better schooled in child psychology, because the more you know, the more you're also worried and anxious about your children's outcomes and your own incompetence as a parent. And so I think and there are other themes related to parenting, but I think that that these are all points that kind of show how they're just so different from, and again, as this hinge idea, and carry forward a set of practices that get picked up in a bigger way in subsequent generations.
I read the chapter on marriage. We have to go back to marriage. By the way, we're like almost 40 minutes into this hour. It's amazing.
Oh my gosh.
Time flies. And there are still a couple of things I want to make sure we get to. So audience questions, again, here's a call for those. Ask us anything. I was reading the chapters on marriage. I will have been married 5 years in a little while. Got married later in life. All these things on timing, right? So interesting to think about. But one of the big issues that comes up in marriage is, how are we going to raise the children? There are other issues that on, the age of the people, of each partner as they come together, religion or economic background, sex, that's an issue, in-laws, kin, money. It's fascinating, to have this laundry list of things that couples in the study are thinking about. I'm not sure it's changed, at least the set of parameters. But I do really want you to talk about sort of what we think of in terms of a quality marriage, what that looked like to people then. I think listeners would get a lot out of that. And I really like these concepts of adjustment and compatibility. Anyway, something in there. Tell us more about that.
Sure. Yeah, and compatibility is highly related to adjustment. Yeah, so some of the ingredients of a good marriage are, as you said, Allison, they're ingredients that are maybe not so surprising, and maybe they're enduring. The compatibility around in marriage, around being aligned around finances, being aligned around sex, being aligned around child discipline, and being aligned or compatible when it comes to the kinds of relationships you want with your kin. Mm. Those are all really key ingredients we find in the marriages that are working well. And again, thinking about the Hinged Generation, this is this is a generation of women who are demanding more egalitarianism in marriage. I mean, more equality. We see that as couples encounter hard times, that this is something that gets talked about in the literature as being an accentuation principle, that any existing conflicts that you have, when you hit hard times, those existing conflicts get heightened. So that like both the good and the bad of people get heightened in challenging times. And we see that in these families as they encounter both the Great Depression and also the war, which hopefully we'll have a chance to talk about that. This is a generation of people who had not gotten sex ed from their parents. They were kind of trapped in a way between Victorian age and the age after World War II. What one woman says is, in the end, people aren't given happy marriages, they develop them. And I think that this idea that the development of a happy marriage in some ways rests on a foundation of compatibility and alignment. And that those things in turn kind of foster adjustment and support over the years. Now, there are some interesting things that happen between husbands and wives during the Great Depression. And part of that for men is that hard times in the Depression become exceedingly painful because men suffer this loss of self-respect, and they also lose the respect of others. And so psychologically, it's devastating for these men who are so tied to their role as breadwinners.
Yeah.
But what's also profound is that their families lose their standard of living and their social standing. And there are really painful stories in here, especially among middle-class families who lose a lot and who are afraid to show that they've lost a lot. There's this sort of saving face in their self-presentation to the world around them that doesn't reveal just how much they're suffering. And there are major tensions between husbands and wives who aren't aligned on living standards in the face of hardship.
Yeah.
So that wives especially, who are inflexible in their living standards and want to continue living as they did, this becomes a major source of friction in the marital relationship.
Yeah, and it was fascinating too to read about how, in like so many of these families in the beginning of the 1900s, they're working in farms and small businesses, and then there's this shift to you called it space and separation,
Yeah.
to where the man is traveling out for work, and I was consistently struck by, when the man doesn't come home and share his experiences with the wife, then that creates this further sort of separation and tension. I can imagine all of that was compounded in the Depression and the financial difficulties of those families.
Yeah, and this is not just the Depression; it also happens during the war. But of course, women are also going to work in that period. But this inability to bridge what have become the separate worlds of family and work. Again, this is one of those hinge issues. It's this generation that's really the first generation to experience the separation of work, people going to work.
Yeah.
Men going to work especially, but women too. And we find actually that for many of the women in these families, they were working before they got married, and that the working class women had been working all along because they were needing to work for the good of their families, for the security of their families. But in any case, it's the man's inability to share his daily life that becomes profoundly difficult in the marriages of these men and women, because he comes home and she's wanting him to share his world, but he's also not able to bridge it very well. And so it kind of accentuates that problem.
And it's all so totally understandable. I really feel like, by the way, we've got a great question from Larry that's going to take us into, I think, war and kin. But it's amazing to me thinking too about COVID times for us now that, here we're reading about, you and I, you're writing and I'm reading about space and separation and how that changes families. And then I'm thinking of like the glomming of all of us all in the house at the same time, and ability to share with one another what our experiences are. And I don't know, I would offer for the audience that hopefully there's a glimmer of like, oh, maybe I could be a little gentler on myself in the midst of all of this, knowing that it's a lot, it's a lot to deal with.
Yeah, can I comment on that quickly? Gosh,
Yeah.
the time has gone too fast, Allison. But um, I hope we would talk a little bit about COVID. But there are some parallels. I think one of my colleagues also noted in another conversation. Like when you think about COVID, there are the reversal system trends that we're talking about in the book. So I think what you're suggesting, Allison, is so the 1900 generation lives through this increasing separation of work and family, but COVID has brought them back together, right? So that for substantial numbers of people who are working remotely, now you have the institutional enmeshment of those spheres that have over a century's time been separated. So many families are really becoming unhinged by their new togetherness. um, and similarly, women were drawn in the labor force to help with the war effort. We see that here, partly explained in the name of patriotism, more than in the name for the middle class workers, more than in the name of the welfare of their families. That ended up boding well for their continued labor force participation over time, and for subsequent generations of women to take up work. Contemporary adult women we know are leaving the workforce in droves to care for their preschool kids, with care centers closed, or to help their school-aged children negotiate distance learning. So you've got this kind of again a kind of reversal happening as a result of COVID. Anyway,
Yeah, the
I
rubber
guess the
band.
other thing I would say is that for these men, so there's the shame and the stigma around work and the depression of not having work, and especially of having wives find work to help support the family. In the war, you have the opposite problem, that an acceleration of work life. Work is so plentiful, and these men and women, but men especially, are working around the clock, and especially in the Bay Area where there are shipyards, to produce unprecedented numbers of these Liberty ships. The scale of production is just unbearable, and it takes its toll on men in particular. Today in COVID, you have a similar problem, right? That essential workers are also doubly stressed, and many parents are working and raising and educating kids in the context of the home, in crowded spaces. So, COVID is just such an interesting lens for thinking about the juxtaposition and the similarities to some of the things that we found.
Yeah. Thanks, Larry, for the question. I am thinking about kin and war and doubling up in some of this. Does the book cover how authority figures outside of parents, educators, religious leaders, etc., affect the participants in the study?
Can you say that again?
Sure. Does the book cover how figures outside of parents, so thinking about sort of external forces to the families, affect the people in the study?
Well, I mean, except that, well, yes and no, I guess. I mean, we're studying what's happening in family life as a function of the changes going on in the outside world,
Right.
how those changes sort of shake up what's happening in families, and how in turn that affects the outcomes of kids and parents. I mean, in this book, we're focused on the parents. But in terms of religious figures, teachers, people like that, no, not really. Is there a particular thought in mind?
Well, I was thinking too, what it struck me was about the chapter on kin, where we saw a lot of, was some, I don't know, 80% maybe of the families involved had some sort of material transfer, right?
Mhm.
During help me out. This was during the
Yeah,
Depression. And then I read another thing about how if somebody did move in with you, that they stayed for 3 years.
right.
And just all of the everything that came with that, sort of going back, right, to what makes a happy marriage. How are the two partners, the spouses, how are they able to communicate? Anyway, that
Yeah,
really,
so I guess what we could say about that is a sort of big lesson that family support has never been easy, nor has having to make do. And I think what you have to remember for these families, born when they were, I mean, they grew up and older and they parented children at a time when many of the government programs and many of the institutions in our society today didn't exist. And that you had to marshal resources in whatever ways you could. And often that meant turning to family. And yet the people who need help are feeling a great deal of embarrassment and shame about it. And those who are giving help are also doing it with some reservation. I mean, or the expectations that aren't expressed, or even resentful or hostile in having to give help to family members. Um, these kinds of tensions are especially strong in the middle class, where this nuclear family ideal is really has a strong foothold. Um, so it's really in working class families that we see much more responsivity to the needs of relatives, and they're taking on burdens, even in the most trying of circumstances, to not only help family members, but also a wider network of people with whom they have relationships. And so I think there are some tensions there that are class based. As you noted, sharing housing was the least preferred way to help kin, but many of them had no choice. As you said, over half of them hosted a relative at some point in the 30s. And in the working class, 75% of them hosted a parent or a child. And as you also said, most stayed for more than 3 years. So doubling up, and again, this is a contemporary issue as well, the doubling up of households means that you're, right, you've got conditions of crowding, and this can be a hotbed of tensions.
yeah.
And we also find that in many cases, it's older parents who are moving in with these parents, and that the presence of parents and the clashing of their worldviews around between grandparents and parents, the clashing of their worldviews around parenting in particular, who has authority in the household, um, the clashing of the old world and the new world with respect to how you raise kids. This becomes a major source of tension in those households.
Yeah, it's remarkable to me. I know I said this in our preparation, the old cliche, the more things change, the more they stay the same. I was reading the parts about, after World War II and the gold rush, and people are moving to San Francisco and there's a housing shortage. And I was like, yeah, what else is new? And that housing codes made it difficult to take in boarders. And I thought about Airbnb and all of those policies, that
Right.
overcrowded neighborhoods and juvenile delinquents. It was like, oh my gosh, right? We we hear folks talking about this today.
Yeah, I think the changing composition of neighborhoods is so powerful in wartime, especially, and how because the Bay Area is a hub of wartime mobilization. You the stories of these people, these families, as they're living through this period, just of being in the presence of danger, of blackouts and dim outs and bomb threats, and the sense that fear was in the air, of overcrowded neighborhoods, as you said, of crime, delinquency, squalor, noise, being in the presence of strangers, the sudden influx of poor Southerners, white and black, become threats to their way of life. The Japanese in their neighborhoods and restaurants and hair parlors and other spaces of daily life suddenly vanish with the internment. The sense that you can't trust other people. And then at the same time, you have a different kind of stranger coming into the Bay Area, and those are all the military personnel who come in by train and by ships in the port, and who are welcomed unquestioningly. And yet, this other group of strangers who are distrusted and a threat to life as they knew it. Just such a, there's so many interesting parallels we can make to our world today, and the fear of people who are unlike us,
Yeah.
and the fear of people who are who have all kinds of divisions, political and otherwise.
Yeah, my grandmother was one of those. She was born in Oakland and met my grandfather, the Navy sailor from South Carolina, who showed up in the Bay Area in 1944. Anyway, I think we have to start wrapping it up. I Any sort of parting thoughts or last conclusions? This was your 7th book. Amazing.
I guess, I know, Allison, that for this series, you like there to be some actionable items around public health. I could maybe offer a couple of quick thoughts, and then I know we'll have to move on. Would that be helpful?
That would be great.
Yeah. So I was thinking about this on my way over. I think one thing that we see throughout the book is that what people experience as they encounter these changes depends heavily on the things you carry into it, right? That so that building people's personal capacities for managing stress, or for building strategies for coping, or having strong mental health, these things, well, they totally resonate with our college model, lifelong health for every person, every family, every community, right? How we frame things makes a difference in terms of the effect that it has on us. These people have taught me so much about the need to be resourceful in hard times. I mean, you hear in their stories the pain of cutting back, of foregoing plans and dreams, but the recognition all the while that, well, that it's people, not things, that matter in this life. And so much of the storylines are also about just that, the protective power of good relationships. If COVID has taught us something too, is that we need each other in order to survive, right? That we're interdependent, and that we have things to learn from each other. And that having strong communities, a kind of we orientation also seems important to foster. This is a group of people who definitely have much more of a we perspective on the world than an I or a me. Which I think Putman's talked about in their new book as well. I think it kind of matches well with our folks. Again, the strong COVID has also taught us about the need for the strong functioning of government and social institutions, and about how fragile our lives are, really, about how quickly they can become undone. And so the fact that we do have to rely on government programs or social and health services, and even the private support of our families in order to, as we live our lives, it seems important to kind of hold that as a truth in a way, and to not feel shame in needing to seek support from those kinds of sources.
Yeah.
And I guess the final thing, I mean, there are a lot of things I could say, but this sense in studying these families, the sense that many of the things that we assume are, well, that they're somehow unique to our time, in our own modern contemporary condition, that we've been there before, and that people have gotten through. And that's given us some hope and optimism along the way, as we've really seen firsthand both the challenges of these individuals and their families, but also the powerful ways that that positive things can also come out, even right? Dark clouds come, but even amid darkness, we sometimes see light. There are positive things that can emerge, ways in which we recalibrate our lives, which we reprioritize things, simplify things, or come to terms with what matters most. Yeah, those are all things I've learned from them. And those are all things that have some implications for public health.
Well, and yeah, and I think the big, you're not alone. Folks you can feel very isolating, but we're doing it, and there's always reason for hope, and there's a lot of wisdom in
Yeah.
community.
Well, the wisdom, and I guess that's the other thing, the wisdom that gets shared across generations. There is something eternal to be learned here about just navigating life and about being human.
Rick, thank you so much for taking the time, for making yourself available. Congratulations on your 7th book. There are a couple of announcements that our dear Casey is going to make before we close up for today.
Thank you.
Well, I wanted to ask Rick one more thing before he disappeared. Like, you finished this book up just as COVID was starting, and so is there going to be a second edition or a follow-up as you were wrapping this up?
Yeah, we were just Glenn and I were just talking the other day, and we'll, I think, pick this up of writing some sort of essay almost as a kind of afterword to the book. Right, because it was already in at the publisher before last January, before COVID came down. And I think COVID, the civil unrest in our nation, the Black Lives Matters, the systemic racism, the political turmoil, everything about the last year, it's no surprise that those things also emerge in the wake of COVID, because COVID exposed some raw, hard stuff. But I think there's so much we want to say explicitly about that topic and in making those connections. So be on the lookout, Casey.
Excellent. That's what I wanted to hear. Thank you to you both, Rick, Allison. Really appreciate the discussion, and to our audience for their participation and their questions. And you can check out anything from the series, and you can also check out, where Rick's book, you can find that on our series website, which is osualum.com/public health webcasts. This is the final episode of our 3rd season, but fear not, we have season 4 coming up. Mark your calendars now. Monday, April 12th, Monday, April 26th, and Monday, May 17th from 4 to 5 p.m. Details on this next season and registration information will be available in the coming weeks. And again, osualum.com/public health webcasts.